Well, folks, thanks for joining us on yet another Monday noontime policy primer here at the Texas Public Policy Foundation. I'm Kevin Roberts, Executive Director of the Foundation, and it's a privilege to host these conversations each week. You know, up to this point, we've been at this about a month. We've been treated to a lot of really special guests, and I think that today you will hear us and see us focus on the topic of the era, and that is healthcare. And so we are privileged to have with us two wonderful members of the Texas legislature, State Senator Donna Campbell and State Representative Tom Oliverson. Dr. Campbell is from the San Antonio area. Dr. Oliverson is from the Houston area. And obviously, in addition to their roles as legislators, their avocations as physicians give them real expertise in what we're going to be talking about today. And certainly, last but not least, my colleague and good friend David Bellot heads up our Right on Healthcare National Initiative. David works really closely with Dr. Oliverson and Dr. Campbell, along with most of their colleagues in the legislature. And so my role today is to kick off the conversation and ask some follow-up questions, but in a lot of ways to get out of the way and let Dr. Oliverson, Dr. Campbell, and David talk to us about the future of healthcare and the future of related policy in Texas. Before we get into the conversation, let me just mention a couple of things. And the first is a note of gratitude. You know, every member of the legislature, regardless of party and regardless of our own philosophical beliefs, deserves a lot of gratitude all the time, but especially right now. And yet, in addition to their years of service to the people of Texas as legislators, both Dr. Oliverson and Dr. Campbell obviously are physicians. And Tom and Donna, I just want to be the first on this conversation to thank you for being in the front lines. In your case, Dr. Oliverson, as an anesthesiologist. In your case, Dr. Campbell, as an emergency room physician. From all of us at TPPF, thank you for your service on the front lines.
You're very welcome.
And second, you bet. And I know you're going to relate some stories that you've seen in the last few weeks and tie those into the policy conversation we're going to have. And then as we get near the end of the hour, we'll take some audience questions. But I know that both David and I have some questions for you. And David, you know I have questions for you. And we'll enjoy the conversation. Let me also say, just as a second introductory point, that I don't think any of us in this conversation, especially the two of you who are physicians, would ever be dismissive of a public health threat. But I also know that we would never be dismissive of social and health consequences that come from an economic and social shutdown that now I think has gone on long enough. And so I know that that's one conversation thread that our audience is interested in hearing us speak about, particularly from the two of you. And I also know that David's got some really good common sense ideas about how we can reopen the Texas society and economy without costing lives. Obviously, all of us in this conversation and people who've tuned in are anxiously awaiting Governor Abbott's update at 2:30 this afternoon. That's important, not just for Texas, but also for America, because as we like to say, as Texas goes, so goes America. So again, thanks for joining us. And David, I want to pitch the first question to you, and then you and our two friends in the legislature can speak about that. And that is, what are the policy implications of this challenge that we're dealing with, that challenge being both a public health challenge as well as an economic one?
Before I answer the question, let me also echo what Kevin said and thanking you all for the work that you're doing on the front lines, working with patients and getting us back to a place where people can be healthy and can regain even more trust for the medical community. But perhaps the biggest implication from my point of view, and this was actually a question that I look forward to getting the answer from our two guests, is we've heard from the president and many state governors and leaders at every other level say that we need to loosen or suspend regulations to bring doctor and patient closer together so they can get the care that they need in a more affordable way. And the real question that I had in the wake of that is, did we need those regulations in the first place? So as I say that, let me now pitch it to Dr. Campbell and Dr. Oliverson. What have you seen in terms of loosening or suspending regulations that has made it easier for you to do your job?
I I don't think that I work in the emergency room. I can't see that any relaxation of regulations has changed my working environment. We still do the same thing. We haven't had any changes that dramatically change how we're doing. Dr. Oliverson, how about you?
Yeah, I agree, Senator Campbell. I haven't seen a tremendous number of changes in my practice as far as loosening of regulations. You know, the whole preparedness reaction to the coronavirus outbreak for us has been more like everybody else. We've sort of been very much in a shutdown mode, doing as little as we possibly can, keeping as many beds empty as we possibly can, and in the thought some massive spike in the number of patients admitted for coronavirus. We just haven't seen that. And in fact, I know we might talk about this later as well, but what I lately is that a loosening last week of the restriction on elective surgery was welcomed by all of my hospitals and surgery centers. And so what we're seeing starting this week, starting today, in fact, is a resumption of our normal elective surgical cases, not at the same volume, but sort of a ramp back up, which I think is an acknowledgement on the part of the medical community that, this is not turning out to be quite the end times pandemic that it was thought to be, and that we have, massive excess capacity that's not being utilized, and perhaps it's time to get back to doing what it is we normally do.
Well, I couldn't agree with you more. We'd written a letter, me and the other two doctor senators, Buckingham and Schwartz, had written a letter saying we need to start our elective surgeries back, inter-office procedures, intra-office procedures, needed to get that going again because patients were being delayed in care or diagnosis, and that's never good. That definitely takes a molehill and can make it a mountain. And some things we were seeing, people that were scheduled to have something done for pain control or something was not happening, and that made it more difficult. Again, I agree 100%, and I think we all did not know what this was a new virus, unknown. We didn't know the characteristics of this virus. And as a result, it had the sky is falling measures, which can't be blamed. I mean, the government, no one knew what it was going to be like. And so it's always good to put safety first, but it is definitely time now. We know enough about this virus that we need to open up our economy. And I say open it up all the way. And I know that's a little tangent off of what you ask, but I say we go for it. And Dr. Oliverson will agree in that normally we quarantine the sick, not the healthy. The healthy interact with safety measures, the common good hygiene measures, but that's how immunity is boosted and herd immunity is developed. And that's what we do with other illnesses. Now, again, I'm not blaming any initial government policies that were trying to look at saving safety and the number of deaths, because every death is sad and regretful. And if there's especially if there's anything we can do about that. But right now, I think we're at a point, and many of us agree, that it's time to open up our economy and get back to life as normal, if you will.
And indeed, the concern is that perhaps these measures are creating more than the virus itself. And what I mean by that is I've heard so many stories from those in the medical community that have talked about patients that are not getting biopsies for suspected cancers. Women are not getting mammograms. Patients that are chronic pain patients not able to get their steroid injections, and in lieu of that are getting prescribed opioids again. So we need to have a more balanced approach, perhaps, and I think you alluded to that and hopefully we can get to a place where it can be a little bit more normalized.
Agreed.
What is your biggest takeaway, would you say, from what you've seen and what you've experienced? Has there been something that you've learned in this pandemic response that you would take away as you move into the next session, perhaps?
Well, I would say one of the things I've seen is that I think our American healthcare system is literally the best in the world. I think it's amazing when you stop and consider the effort that was put in by our hospital systems, our emergency rooms, our freestanding ERs, our surgery centers and endoscopy centers. I mean, what we were able to do in terms of ramp up, in terms of discharging folks, rescheduling things, preparing, making sure we had adequate equipment. I mean, if you look at the data, there was a huge ramp up of personnel, material. People were innovating in ways that we hadn't even thought of. In my neck of the woods, we were even saying, if it gets really, really bad, every surgery center operating room has a functioning anesthesia machine, which is a functioning ventilator. So, we just had preparations beyond preparations beyond preparations. We were abundantly prepared for a massive pandemic that just so hasn't really materialized. And I just credit that to the type of healthcare system we have. We don't, everybody's kind of out there in the marketplace. And so there's always excess capacity on any given day. And that's a beautiful thing, giving people the ability to innovate and the ability to rise to meet demand as demand emerges. So that was one of the biggest things I saw.
I agree with that. I think what we saw in general was the nation and businesses and those that are doing research able to really quickly move and focus to help develop work on vaccines so that can get out at a quicker release than usual, 1.5 years compared to 3 or 4 years, able to quickly start finding our supply chain for PPE. And next session, I'm sure we will revisit having our own stockpile of PPE. We demonstrated that, and at the same time, they came up with testing, both, serum versus the actual swabs. So we looked at expanding testing, expanding personal equipment, protective equipment, expanding treatment, looking at different treatments, and all this started happening right away. So that's a big thing, to see how quickly we can turn things around to focus just on one problem was great for America. And then looking at those companies that have retooled what they normally do to provide equipment or sanitizer, things like that. So good, it wasn't the apocalypse it was anticipated to be. Good, almost like a training ground, if you will, for something that in the future could easily be truly a pandemic that was serious. And I'm not saying it wasn't serious, but serious enough to take more lives and have a higher death rate. It's important that we recognize the public became accountable, took responsibility for their own actions. Many people with gloving, masking, hand washing, sanitizing. And out of all this, I believe those behaviors will continue. I think people will continue to wipe down their grocery cart. Some may wear masks. Most certainly, I think people will have better hygiene and start washing their hands and be aware of the fomites, the things that people touch that have germs on them. Because it's not just COVID. There's all kinds of nasty bugs out there.
I completely agree with you as to the response of the private sector, both individuals and organizations. They have proven nimble and adaptable, and we applaud them because they have been heroes and have done things that they didn't necessarily have to do, but they came together for their community. Dr. Campbell, you mentioned something that I'd like to touch on. You talked about testing. As you both have heard, there's just been this call for massive testing, and that's how we're going to get past this thing. Give me your thoughts on that, and could you educate our viewers on the different kinds of testing, and is that really what's going to get us moving forward?
Well, I'll appreciate Dr. Oliverson's input also. Testing is important to know about the prevalence, to know more about how the virus acted. We absolutely believe there's more people that have it than we've measured, which means the prevalence is bigger, which means, or broader, which means the death rate will actually come down, because the more people that have it, as that number grows, death rate is lower. We'll actually see the percentage of the lethality of this virus be less, which is a good thing. That's, to me, the real importance about the testing. If the majority of people are asymptomatic or have very mild symptoms, if they think they have it, they just need to self-quarantine. Testing someone today and they're negative is not going to guarantee they're negative in 3 days, but yet we don't continue testing people. That's a waste of resources. I feel our resources need to be better placed in those areas that have mandatory congregate care, our nursing homes, our state-supported living centers, our jails, the TDC, our retirement homes. Now, those people, they're not only vulnerable, massed together, but there's people going in and out that in the facility and out to the regular general public. That's where a lot of testing, I feel, needs to go on. But just to randomly test the public, if we're looking for measuring prevalence, that would be significant. And I think that's where a lot of people trying to weigh in on when to open things up are trying to find a downward trend supported by enough numbers to define the prevalence. What do you think, Dr. Oliverson?
Yeah, I completely agree. So there are 2 types of testing. One can test for the presence of the virus, which is sort of that deep nasal swab that Senator Campbell is talking about. There's also antibody testing, which is starting to become, I think, more of the gold standard. There has been data that has come out of 3 different locations in the United States, as well as other locations in the Netherlands and Germany, and I think even China. I think even the WHO now has a large antibody study, because we're realizing that the prevalence of asymptomatic infection is literally so high that it becomes almost impractical to surveil the progression of the disease by doing nasal swabs, because you don't know who to swab. And I know Governor Abbott will probably bring this up again, but he's mentioned this several times, and I have seen this firsthand at testing locations in my area. Every single time Department of Health goes out and has a drive-through testing location, there are tests that go basically unused every time. We may have 75 tests for a day in Tomball, and not all 75 tests are actually performed, which tells me, again, you can make the resources available, but it doesn't necessarily mean that people are going to show up and test. So just sort of scattering about and having testing resources sort of set up here and there, that might have been very useful early on to sort of allay people's concerns and fears. I think as we evolve in this process, though, the primary conduit for testing now has to be at point of care by the healthcare provider, and also I do think there's still a role for contact tracing within our departments of health, particularly, as Senator Campbell mentioned, when you're talking about folks who are not able to socially distance because of the living environment that they find themselves in. It becomes very important, if there are people who are infected in that area, in that community, to be able to screen them. But I think, what you're going to see in the month going forward, now that we have some very, very high reliability antibody testings. I think our hospital is now using the Abbott Labs test, which is like 99% sensitivity and close to 100% specificity. So it's very, very good. This is a much more useful way of surveilling the disease's progression. I think at the end of the day, we're going to come back and realize that this thing was spreading through our communities months before we started seeing images from Italy and getting very concerned about what could happen back home. And so I do think that at this point, those that are just sort of demanding unlimited testing as a precondition to opening the economy are kind of missing the boat here. I just don't think that at this point is going to be necessary, and you're never going to get the level of certainty that some of these folks want. So at some point, we just have to move forward.
Well, thank you both. As far as going into the 2021 session, what about this pandemic has caused you all to think a little bit differently as to what you'd like to address and how we can make healthcare more affordable, more efficient, and more accessible for the people of Texas?
Well, I guess I could start on that one. David, you and I have spent a lot of time talking about this. I think accessibility, we have to understand that the main problem driving lack of access to healthcare right now is affordability. We have plenty of healthcare in this country and in this state, but the reality is for a growing percentage of Texans, it becomes unaffordable. And so really there are only two main solutions I can think of. You either take the responsibility for payment away from the individual and give it to government and let the costs continue to escalate and hopefully put some price controls in there. And that's sort of the, expand Medicaid single payer type solution. Or we do what Americans do best. We inject some free market thinking into our healthcare system. We require transparency and require providers to compete on price and quality. And I'll go out on a limb here, but I'm sure Dr. Campbell will agree. I got no problem with folks that want to see what I charge for things and, compare quality for my services with other providers. And I am not afraid of that as a provider. We don't really do that, but it's past time that we do, because that actually addresses the underlying problem of affordability. And to me, that's the main thing that we need to address. Our healthcare system is second to none in the world in terms of what it's able to achieve. But what it's able to achieve may realistically be out of reach for far too many Texans because of affordability issues. And that's what we have to address.
And if I can just, before Dr. Campbell jumps on, I wanted to make our audience aware of the fact that for those doctors that are contracted with insurers, many of those insurance contracts prevent physicians from disclosing their negotiated rates. So even if a doctor wanted to show you the price, the real price, they're contractually prohibited from doing so. Dr. Campbell, you were going to say?
Well, I agree with Dr. Oliverson. I agree with you. I believe we've got to have health care insurance reform. That is the tail wagging the dog. We need to be able to inject that competition in there. We need to be nationally, we need to be able to buy health care insurance across state lines. We need to have that ability to customize our health insurance. Right now, they are such a wedge between the patient and the doctor. The government, if the government is a wedge between the patient and the doctor. Healthcare insurance is a wedge between the patient and the doctor. Somebody can be, and we all know this, there are so many stories. A patient is going, they're functioning well with specific medications, their specific doctor, their specific treatments, and insurance will change at their company and they have to go back through things, or all of a sudden their medication is denied. We hear stories like that all the time. Healthcare insurance companies are the ones that say yes and no. They are practicing without a license. They're practicing medicine without a license. It is wrong. It needs to be changed. And healthcare insurance reform needs to be done on a nationwide level. They are no more transparent. Patients do not understand the fine details of their policies, yet premiums continue to go up. What insurance companies pay continue to go down. Providers every year are being paid less and less. And that's not how it's supposed to work, number one. And if physicians are going to, they will get out of it. They have got to make a living. They've got to be able to support their office staff. And if that's not going to happen, we're going to continue to see a dearth of physicians. And we need more supply, not less. We don't need to just replace physicians with another type of healthcare provider. Quality needs to be maintained, and we need insurance reform.
No, completely agree. Something we say often here at the foundation is that there is a difference between healthcare, and health insurance. Healthcare is what happens between doctor and patient, and health insurance is the financing vehicle. And we need to stop being so insurance centric, as you so adequately or so appropriately said earlier. One thing I wanted to ask you both. It's been a concern for many people who've been talking about it. You may have seen Dr. Fauci and Dr. Birx recently talk about the new codes, the confirmed case of COVID-19 and then the suspected COVID-19 as a code itself. And during a press conference, they admitted to the fact that they were going to take a liberal approach. And so if someone came in, say, with a heart attack, stroke, any number of things, but also had COVID, that it was going to be a COVID case. And many of those who were having to sign off on a death certificate, COVID is the primary diagnosis. Is that something that you all are seeing? And I'd love to hear your comments in response to that.
Well, I haven't seen that. I haven't had to sign off on a cause of death yet with defined COVID as the cause. I think it's false statistics if somebody really is dying because of a heart attack and you're putting down COVID because they had COVID. The argument could be made, well, they may not have died of a heart attack had they not had the virus. But somebody can have a bad heart condition, exercise, die of their heart attack, but the cause of death was not exercise. It was because they had the morbidity of heart disease. And similarly, somebody can have diabetes and be obese, and when you get into the pathology of how all this works, end up with this bad inflamed systemic condition going on in their body because this enzyme is revved up. But they have the comorbidities of diabetes and obesity. It could be an additional diagnosis, and we do that frequently. But to push it to a new diagnosis of COVID death, I'm a little suspect that it may be trying to condition going on in our body, some statistics that would not be pure.
Yeah, I think you just basically have to put an asterisk next to the cause of, to the total number of deaths due to COVID. And that will be a job for, the epidemiologists and the folks that do this for a living. But I think it's safe to say that not everybody who's being counted amongst the deaths related to this virus died of this virus. To Senator Campbell's point, I mean, that's a perfect example. Yeah, so somebody has bad heart disease, and so they exercise. Exercise didn't kill them. Heart disease killed them. So the fact that COVID maybe pushed them over the edge when, truthfully, they have all of these severe underlying medical conditions, that may be the more appropriate cause of death. So I don't necessarily know that there's a lot we can do about it right now, other than I just think it's really important that everybody realize that that number is probably hyperinflated compared to the true number of people dying from the virus.
Well, the concern that's there obviously is because of the legislation that came out of DC, where they've given a 20% increase in reimbursement for COVID. It creates a perverse incentive to tack on a diagnosis of suspected COVID so that they can increase those reimbursements. Oftentimes we see government solutions contribute to more of the problem, and I think that's what we're seeing there.
And it could be, David. I mean, we'll see. I remember when that came out thinking, I'm not sure that's a good idea, but yeah, we'll see. It'll be interesting to do the after action report on that and see to what extent that 20% caused people to massively balloon the number of fatalities associated with this virus.
An important question I want to ask you both is this: there's still a lot of fear out there, and understandably so. But what role can the medical community fulfill, if any, to reduce the fear so that the nation is willing to restart a normal level of commerce?
If people will just walk in wisdom and not run in fear. They're getting information everywhere. They're seeing people get back out, whether they're supposed to or not, back to a normal life, and control your sneeze, in a Kleenex and get rid of it. Those kinds of things. And if the media will help us not just continue to cast fear out there, I think we will do great.
Yeah, I completely agree. I think, the medical community needs to be transparent and honest about what we know and what we don't know. This is one of those situations where I think, everybody kind of sees the writing on the wall that maybe this isn't as bad as we thought it was going to be, but there's a great amount of fear, I think, even amongst medical providers and decision makers that, well, it looks like it's not going to be as bad, but gosh, what if we're wrong? Shouldn't we just, continue what we're doing for another month and, be doubly, triply, 100% sure? Because, if we're wrong, then deaths could go back up again and people could start getting sick again. I think at some point, I learned this a long time ago as a physician, that as a doctor, part of my responsibility is to help the patients decide what they think is best, right? It's not just sort of me autocratically dictating how it's going to be. And to Senator Campbell's point, I think we have to accurately explain the risks, let everybody know that nothing is for certain. We don't have a crystal ball. But at this time, the evidence that we have is starting to move in a direction that suggests that maybe we don't need to be locked down like we've been, and that simple universal precautions are probably sufficient, and social distancing is important, and all these things. But I'd really like to see in the medical community, I'd really like to see more medical providers be more honest about their own fears of uncertainty. Because I think that's really driving a lot of it, is just sort of well, I'm not 100% certain that it's getting better, so hence I'm just going to either say nothing or I'm going to continue to say it's terrible and we haven't seen the worst of it yet. And I just don't think that does anybody any good at this point.
Well, I'd like to say thank you once again to both of you. Thank you for your time, for your expertise, for your experience. And I'll kick it back over to Kevin to see what we have from the audience.
Yeah, thanks a lot, David, and to Representative Oliverson and Senator Campbell. Thanks. We'll sort of enter the next little phase of this conversation and work in some audience questions. We've had a couple of them asked already by David as they've come in during your conversation, and I'll get back to those in just a minute. But if you are in the audience and you want to submit a question, just do that in the comments box. And my question for the two of you sort of focuses on this economic recovery at reopening Texas. And I'm really grateful for how articulate each of you has been when it comes to how we might go about that. But let's fast forward. Let's assume, as I think all of us believe, that the reopening will go fine, that in fact we can accelerate that in Texas, especially in Texas. And we get closer and closer to the legislative session that starts in January. And obviously the big topic is going to be the state budget. I don't think any of us are optimists about how those numbers will look. I'm curious, based on the experience you've had in the legislature up to this point in your careers, how bad do you think that state budget picture is going to be as a result of this pandemic? Senator Campbell, let's start with you.
Well, you can probably tell by that facial expression I just made that I didn't mean to make. We are going to have some challenges, most certainly. We don't know how bad it's going to be. The comptroller can't tell us. We don't have the data yet. It's anticipated we will be billions as a shortfall. With the price of oil per barrel, that's not helping any, that's hurting us. And even oil futures by the end of July, they barely put it at $25 a barrel. And the state needs closer to $60 a barrel to take care of our needs. So we do have challenges. We most certainly want to maintain the property tax reduction that we all worked so hard on last time. We want to maintain the promises that were kept to education, and we had to make that school finance reform in order to have some of the changes with our property taxes. That in itself is a costly figure. Then to add to it, we have hurricane season, tornado season, just encroaching. Any of those disasters are most certainly costly, right? So yes, appropriations and our budget are going to be the most challenging, probably the most challenging part of the next session. But on top of that, we have redistricting. We have the mass violence that we can't forget about, as well as just our other duties. So it's going to be a challenge.
So that's one way of asking everyone in the audience to pray for all of you, right? For wisdom, for patience.
Yes.
Dr. Oliverson.
So
thank you. Thanks, Dr. Campbell. Dr. Oliverson, what do you think?
Yeah, I have not served in a session where we had budgetary challenges, and Senator Campbell, I believe you have, and so I'm going to defer to your expertise on this. But yes, it's going to be challenging. I would throw out one thing I would add to the mix is that I think that if we're thinking that we're going to expand spending next session in any category, that's going to be a tough sell. One of the things that gets bandied about a lot is to expand Medicaid, to not expand Medicaid, and I would just point out that Medicaid expansion requires a state match. So if the feds, I've heard some of my colleagues on the Democrat side of the aisle say we could pull down an additional $1 billion from the federal government for Medicaid, and boy, we really could use that money. Well, that requires a 10% match from the state. And I don't know about you, Senator Campbell, but I don't think we could find that this next session, that match. So that kind of blows that right out of the water from the get-go. So we're going to have to get creative. Look, we will overcome. We're smart and we're self-reliant, and Texas is, if anybody can get their economy, chugging again, it's going to be our state because we are a business-friendly economy, and we believe in self-reliance, and we believe in being open for business. And so I'm hopeful, but I think there are going to be some significant challenges. But I wouldn't plan on increasing spending anywhere in the next legislative session.
No, I agree 100%. I mean, you're right on target. And every dollar that we get from the federal government, there's strings attached. So it's not like we're getting free money. We will have to pay for it in some way. And so that's not how we operate. We can't operate that way. We want to limit government, not have more strings attached to the federal government. So that's not how we operate. And I'm right on board with that, Dr. Oliverson.
Well, the two comments that y'all have made in the last couple of moments are certainly music to my ears. It's been challenging, even frustrating, to see the allure of so-called free money really cause rational thought to go away. And so I'm grateful to the two of you and many of your colleagues for holding firm on that, because we know, largely because of David's good work, about the flawed thinking about Medicaid expansion, what a bad idea that would be. And David, by the way, I'm going to ask you a question or two about kind of the DC side of things, but Senator Campbell, Senator Oliver, or Representative Oliverson, I want to stick with this line of questions we're getting from the audience about the next session and ask you a follow-up. And there are a couple of specific questions. I'll just make a general one. It's still early to know, but is it your sense that when you get into the next session, that amid appropriations and all of the other things you'll be dealing with, along with just regular order, which has to happen, is there a sense that y'all have that the legislature is going to want to look back and diagnose how state agencies, state government handled the pandemic? In particular, one audience member is wondering if the state has too much power or if local authorities have too much power. Have y'all had a chance to think about those questions yet?
Well, I certainly have. I would say the answer is yes and yes. I think one of the things that Governor Abbott did immediately after Hurricane Harvey, which was really brilliant, is we did a comprehensive after-action review. We created a task force, and we actually looked at what went right and what went wrong in the state's response to Harvey. And the result of that was that when we came to the legislature and this last year, Senator Campbell and I had a whole list of recommendations of things that we had, some things I hadn't even thought of, like how do we manage hurricane debris, after it's out on the street, where does this all go? Do we need better infrastructure for dealing with that? There needs to be a comprehensive look back, and I think, I'm confident that we will do that. And to your other point, I think that we have clearly seen across the state actions taken by local elected officials which go far beyond the pale in terms of, I think, what we originally believed that the chapter dealing with, I think it's chapter 518, I could be wrong on that, but the chapter dealing with emergency powers and disaster declarations, folks have literally just gone to town on that. I mean, I'm sitting here in Harris County where in theory I can be fined $1,000 for stepping outside my home without wearing a mask. That is not what we envisioned in terms of disaster management. So Senator Campbell, I'm guessing you would be on board with having a comprehensive look at that chapter. And I think we need to rein these folks in big time.
I do too. I'm in 100% agreement. We have federal regulations, then the state regulations, the county regulations, and the city regulations. That's too much. We can't, it's difficult to have a patchwork, if you will, of regulations. And this is a medical, an epidemiologic, and infectious problem going on. Yet the people that are making the rules, the mayors, county judges, state level, federal level, they may surround themselves with those with medical knowledge, but some of the regulations that they've put out there don't have a scientific foundation, and that needs to be reined in. I'd rather see, whenever there's a pandemic, something like this, bless you, would like to see maybe just at the state level in conjunction with the federal level, then it's easier to start lifting and making changes. But if we've got the mayor in San Antonio, same thing, you've got to have a mask on, versus just a suburban area that abuts it, you don't have to. So then when you cross into city limits, you've got to make sure you have your mask. And the city should provide masks then. If they're going to mandate everybody has to have one, they need to have a place where everybody can pick one up. So I think I've gone off on a tangent, but there are too many layers of government that have influence over something that's a pandemic. That
Well,
needs to be.
thank you. I don't think it's a tangent at all, Senator Campbell. I think that's spot on. I think what we've seen in Texas, especially along the I-35 corridor, plus where you are, Tom, in Harris County, is some local officials really taking advantage of this and advancing an agenda that is more political than it is based in substance. And late last week, I had the opportunity to talk to some county officials, county judges, and other countywide elected officials in suburban counties around Austin and Houston. And to the person, regardless of party affiliation, in those more suburban counties, they want one consistent set of standards statewide because that's more predictable for them. It's more predictable for us on the ground as we're going about our lives. And I think that makes a whole lot of sense. We have this tendency in Texas more and more to forget that counties and cities are political subdivisions of the state. And this to have to use the phrase state preemption of local authority sounds really bad. But in fact, especially in matters of emergencies, it's rather appropriate. So I imagine that might be one of the themes we see next session. So I appreciate your comments.
Yeah,
David,
I'd like to just add to that really quickly.
Sure.
I tell you, Kevin, I think it's shocking arrogance on the part of some of the local elected officials. I've seen situations where my county judge essentially has told Governor Abbott to take a hike on things that he's specifically said not to do. They've said, well, we're going to do it anyway. And that is not the way, to your point, that's not the way that government works in this state. The state creates all of these political subdivisions, and ultimately the governor has the authority to say yes or no. I mean, we talk about local control, and I believe in local control, but local control can also be unconstitutional. I mean, I never, ever in my wildest dreams thought that I would wake up one day and have to worry about whether the police were going to show up to a church and basically.
So thanks for your good thoughts about that. I'm going to come back to the two of you momentarily, but just want to ask David a question about the level of government that's really driving the train on this, and that's the federal government. David, you spend a lot of time working not just on healthcare policy, not just here in Texas, but at the federal level. And as the three of you know, the state and federal actions in healthcare, of course, are intertwined. David, I'm curious what you think about the future of healthcare reform, which has come up a couple of times in our conversation. In other words, based on the reality that we're in, based on the reality, too, that this is a presidential election year, do you think that at the federal level, some of the perhaps smaller, more temporary reforms that have been made have hope of not just becoming permanent, but being expanded on?
Well, I know that there are a number of attempts to get those kinds of waivers codified, to put into legislation, to put into law. It's going to be a challenge. And I'll say this, you mentioned it's an election year. This election is going to be paramount when it comes to healthcare. And if we continue with the current administration, I can say that this administration has been the most impactful as it relates to healthcare and putting power back into the hands of physicians and patients. And I think there's no question that if someone else were to take on the presidency, that we would see something, or we would see movement towards a more government-controlled healthcare system. And as Dr. Campbell said earlier on, that would only be more insurance-centric. The ACA or Obamacare really was a boon to the insurance industry, not for healthcare itself. Because as I said before, when you hear most politicians in DC talk about healthcare, they're really talking about health insurance. So we need to be very active about working with our lawmakers in DC about bringing healthcare back to that relationship between doctor and patient, giving them the ability to use their own dollars. being able to see their physician via telemedicine if should they choose to do so. Having a direct primary care be more mainstream than it already is. And so those are the things that I would say. But absolutely, I'm a big proponent of making a lot of these regulatory waivers more permanent and getting them into law and not just as an order itself.
Thanks, David. So last question, which I'll pitch to each of you, and ladies first, Senator Campbell, so we'll start with you. And that's just a more general question. One of the things we're trying to do here at the foundation in these conversations is provide some optimism amid a lot of reason not to be optimistic. In fact, we released the second of our kind of inspirational videos today. This one's focused on a local employer, very much a startup small business that has played a really important role in changing their manufacturing to manufacture masks, starting for physicians and other healthcare workers. And so in that spirit, and just sort of a general sense for our audience members who are working from home, maybe there are some who've lost their jobs temporarily or permanently. What are your words of hope for them? And what are your words of encouragement for how each of us in our communities, wherever that may be, can play a role in what we need to be a gigantic economic and social recovery?
Well, I would say that I think we're almost there. I think that we can be encouraged with this downward trajectory of deaths, of more cases. Of course, we're going to see more cases positive just because of testing, but the prevalence of death will be less. I think we can be encouraged that we are almost there. Our economy runs on the backs of small businesses, and I'm concerned that some small businesses may not recover. But I've seen the public come together to try to support the small businesses. And that's what we need to do. We need to shop local, support our mom and pop restaurants. I do believe the franchise chains will do fine. But when we get back to normal, whatever normal is, we want to still take some messages with us. And that is why we've isolated ourselves. We want to help those who have been alone. And even when things open up, don't let them stay lonely. And I'm talking about our elderly and some of our veterans. I would also say that if you're going back to a struggling business, give it all you got. Say your prayers. Leave nothing on the court. Rebuild. Come back stronger. And I would say, never doubt in the dark what you learned in the light. This was only a season. We are coming back, and we will work together, and we'll keep Texas strong because there's not another Texas to move to.
Amen.
Amen.
Dr. Oliverson?
Yeah, I completely agree, and I'm not sure I can add a lot to that. Honestly, I think that was perfect. We still have to be careful, and I think Senator Campbell, Dr. Campbell mentioned that. We still have to take precautions. But what we've been doing as far as isolating ourselves and sort of shutting everything down, that's coming to an end. The data's out there. That's not necessary anymore. But that doesn't mean that we should just go back to normal. I always like to tell people, look, there is no return to normal after something like this. There's a new normal. I'm not sure, we're going to get back to, hugs and kisses on the cheek and stuff like that for years. And I also think that it's very likely that as this disease fades for the summer, perhaps if it's true to the flu pandemics of the 1900s, it may come back next fall. So we should be prepared. We should continue to have PPE in our facilities. And I know Dr. Campbell and I are going to continue to follow the precautions that the CDC recommends when we're caring for patients. And we ask, people to be patient with us because there's going to be a new normal in healthcare too. But I think people should be encouraged. I think the storm clouds are breaking, and I think that probably some restraint and some common sense is necessary, and we're good at that as Texans. and that's kind of what we need to do moving forward. And but we need to get back out there. It's time to get the economy open back up.
Thank you very much. David, last word.
I'd like to echo what was just said, and thank you both for saying those things. You know, if we look at history, we've had pandemics, we've had wars, we've had terrorist attacks. And the one thing that has been consistent about this country, and especially that of Texas, is that communities come together. And not only are we normal again, but we're better. And I would encourage everyone to look to see how they can be better, how we can be more consistent and more true to who we are as Texans, and to care for our communities. And I would encourage those that have the means, when we have our businesses back open again, buy a little extra, tip a little more, and help out your neighbor and help out those that are trying to regain and rebuild from what we've just been through.
That's well said, David. I just want to put a plug in for small businesses. Nothing against any business, you know, wherever they're located in the United States, but small businesses, locally owned restaurants. Now's the time, if we're going to be spending some money on eating out, to really patronize them and to tip better and to do our part. That's how those of us who believe in limited government have to live, in order to make sure that government doesn't permanently crowd us out of civil society. And hopefully all of you who've tuned in are seeing that messaging more and more from the Texas Public Policy Foundation. Senator Donna Campbell, Representative Tom Oliverson, my friend and colleague David Ballat, I can't thank you enough for a wonderful hour. What a substantive and also very encouraging conversation. I want the three of you, but particularly the two of you legislator physicians, to know you're very much in our thoughts and prayers as you're in the front lines in your professions. You know that you're already in our doing during this crisis. Next week, we're going to pick up with one of the themes that came up a little bit, maybe even a lot, and that's local government overreach. Come back this time.